Radial tears are perpendicular to the circumference, and they can be straight or curved. Radial tears, unlike the longitudinal tears, look like they come and go as you page through the coronals or sagittals. You might only see these on one image. This is another situation in which you might not match criteria for meniscal tear because small radial tears might only be seen on one slice. Axial images can be very useful for diagnosis. And here we see a large radial tear with an associated bone bruise at the lateral meniscus. The axials, you see the rent in the meniscus. Curved radial tears are called parrot beak tears, and they will appear to page through the meniscus as you go through sagittals or coronals. Here, what looks like a radial tear of the medial meniscus actually has a curved configuration if you look at the axial images, and it represents a parrot beak tear. Why are these important? Because that parrot beak fragment can flip into the joint and lead to locking and snapping and things like that. When you have a combination of tear types, we call these complex tears. But if there's an unstable component to the complex tear, I like to describe that separately. So if there's a radial type configuration, parrot beak, a flap or flip fragment, or a tear at the root attachment, I'll say there's a complex tear of the medial meniscus, for example, with a tear at the root attachment.